Now, today we're talking about the medicine Amiodarone. Amiodarone or Cardarone is one of the most important medicine, which is extremely commonly used in ICU, especially for tachycardias, for atrial fibrillation, ventricular tachycardia, WPTW syndrome. Now we must know that this is actually iodine-containing drug. So almost 38% of the amidon content is iodine. That is the reason why it can cause hyperthyroidism or hypothyroidism. But the incidence of this is lesser and it increases with increased usage of the amidon. It is extremely highly lipophilic. That is the reason why the effects of this amidron they last for a very long period, and this is one of the very long acting arrhythmic drug. Now, how it acts is it prolongs the action potential duration. It partially inhibits myocardial calcium channels. It is also a non-competitive beta blockage, and the conduction is markedly slowed at AV node, at the ventricles also, and the ectopic automaticity is markedly reduced. So it has a array of mechanism of action. That is how it acts at multiple levels, and it causes or it treats the arrhythmia, especially tachycardias or ventricular tachycardias or supraventricular tachycardias or the atrial fibrillation as well. The half-life of drug is extremely high. It is around 3 to 8 weeks. That is because it is significantly stored in fat also, and it is released over a period of time from this muscle's fat very slowly in blood. Uses, there are n number of uses of this cardron or amidron. It is one of the most important and the first line of drug for ventricular tachycardia. It is a very highly effective even in PSVT, paroxysmal supraventricular tachycardia. See, for PSVT we have adenosine which is always given through IV, through the central line, or the intracath which is placed as close to the heart as possible. Through elbow also it works. It is given in 6 milligram, then 12 milligram, and 12 milligram. For PSVT we also have diltiazem, but apart from these, if these drugs won't help, or if these drugs don't settle down these SVTs, Cardarone can be 100%, or it is a very effective alternative to revert back this SVT. Atrial fibrillation, this is one of the most common reason why Cardarone is used. So VT, PSVT, atrial fibrillation, these are one of the most important reasons why amidron is used. Then resistant ventricular tachycardia, ventricular fibrillation, WPW syndrome tachycardias, because in WPW, diltiazem cannot be used, but in this case amidron can 100% be used. And one more thing is this amidron has shown to have a protective role in long term to reduce the risk of sudden cardiac death. So cardron is one of the very effective medicine which can definitely reduce the sudden cardiac death risk in patients with heart failure. So, what are the adverse events? Adverse effects are hypotension is one of the most important problem. So, in atrial fibrillation, especially when it is new onset, very commonly the loading dose, that is 300 milligram of 300 milligram of cardron, can be given as bolus as well. But what I have commonly found is in these patients, hypotension can definitely develop. So, instead of giving rapidly or as a bolus, it can 100% be given in 150 milligram, even in 100 ml NS over a period of 10 to 30 minutes. This also works wonder, and it can also revert the atrial fibrillation to its normal state. As it contains so much of iodine, stimulation of thyroid gland can cause hyperthyroidism, and excessive iodine can also downgrade the activity of the thyroid gland, and the patient can also land up in hypothyroid. These both phenomena can happen because of this iodine content of this amiodarone medicine. Photosensitization, pulmonary fibrosis in long term can also occur, but this pulmonary fibrosis is very rare if the dose used per day is less than 200 milligram per day. And peripheral neuropathy, definitely it can also occur because most of the time patients do have hypertension, diabetes, and other medicines also. So these are more prone to develop this peripheral neuropathy. So for ventricular tachycardia, obviously a stable ventricular tachycardia, because whenever we are talking about unstable ventricular tachycardia, then cardioversion shock is the option. But if the patient's blood pressure is good, if the heart rate is palpable, if patient is conscious, obeying, it means that patient's ventricular tachycardia is stable. 150 milligram of IV bolus of Cardarone can be given. It can be again repeated the same way. This 150 milligram of Cardarone can be given in 100 ml over a period of 10 to 30 minutes, especially in atrial fibrillation, especially for a new onset atrial fibrillation. This can be repeated as well. For refractivity, again 150 milligram of IV bolus of amiodarone can be given. It can also be repeated. If the patient has hypertension, simultaneous institution of vasopressin or noradrenaline will definitely help to keep the systolic blood pressure to at a certain level, at least for more than 100 or more than 110 millimeters of mercury, depending on patients or individual variables of like age, EF, and other parameters. And for supraventricular tachycardia, definitely the 150 milligram of this amiodarone can be given diluted in 100 ml NS, and it can be given over a period of 10 to 30 minutes. This usually very commonly reverts this SVT to a normal sinus rhythm very, very beautifully. So we know that the risk of ventricular tachycardia, occurrence of recurrent ventricular tachycardia is extremely high once the patient gets ventricular tachycardia, especially after MI or after pulmonary edema or after LVF or because of some other reason. So we always load the patient with 150 milligram of IV bolus of amiodarone, or it can be given in 100 ml over a period of 10 to 30 minutes. It can be definitely reverted or repeated, and once the normal sinus rhythm is achieved, we then continue the infusion of amiodarone over a period of 24 hours. Now this infusion dosage is 1 milligram per kilogram per hour for 6 hours, and then for next 18 hours to complete 24 hours, we give the amiodarone at 0.5 milligram per kilogram per hour. Now how to calculate it is extremely easy. I'll tell you that. And once 24 hours are complete, then oral amiodarone research can be started from 200 to 600 milligram per day, mostly 100 milligram TDS or 200 milligram twice a day. This is the dose that is usually started. Now, how to start or how to prepare this amiodarone infusion is very important question. We can take 750 milligram of amiodarone, that is around 5 ampoules, and we can dilute that in 50 ml NS, so that total will be 50 ml, which will have 5 ampoules of amiodarone, means 750 milligrams of amiodarone. So 50 ml has 750, it means 750 divided by 50 is equal to 15. So each ml will contain around 15 milligrams of amiodarone. So if patient's body weight is 60 milligram, for first 6 hours we need to give 1 milligram per kilogram per hour, means 60 milligram for 60 kg per hour. So we can simply do calculation, and 15 into 4 is equal to 60 milligram. So 4 ml per hour can be given for first 6 hours, and after the 6 hours we can give 2 ml per hour for completing 24 hours. So the rescuer of amiodarone. So in case even after giving the amiodarone, if SVT is not settling or atrial fibrillation is not settling, the rescuer is always almost diltiazem, and same is almost reverse for diltiazem. If diltiazem is not reverting the SVT or atrial fibrillation, amiodarone can be used, and if amiodarone cannot revert back the SVT or atrial fibrillation, diltiazem can be used. Both these medicine have very, very high efficacy. Thank you.